My name's Deirdre Morrissey, and I'm a nurse practitioner, and I work here in San Francisco. I definitely am a big proponent of sort of health maintenance. With my first son, I had a really long, painful labor. I was a little bit worried about having that experience again, especially because I had terrible back labor. And it's hard when you're a mom and you're working full time and you have a kid and you've got to put in hours at their preschool and fix dinner and take care of everybody and everything. It's hard to make time for yourself. Figuring out a way to do that, especially at least for the time that you're pregnant. And
it's a great time to get adjusted because a lot of times they have back pain, they're uncomfortable because their body's changing shape and they're carrying all this weight in the front of their tummy. So it helps a lot with just having a more comfortable pregnancy and enjoying being pregnant.
I didn't realize how beneficial it would be for me. I mean, the main difference was not having that back labor. Later on, when I actually had pain, that I said, okay, I'll go. In the middle of the night, woke up sort of screaming in pain. I've never had any pain like this before. I couldn't touch anything to my foot, to my lower leg. It just was exquisite pain. It felt like, or how I described it was the pain chamber. That was the bizarre pregnancy-related pain that I had. But it felt like my whole pelvis was falling apart. Felt like my pubic bone was separating and my sacrum and my SOI joints were separating, and it was just brutal. So I saw Christine, I saw you, I called you, and I saw you that very night. Immediately that night started to feel relief. I was impressed.
But it also really helps with the labor and delivery, because when the pelvic bones are balanced and moving, when the person is connected to their body and able to feel what's going on, the labor and birth is like much easier and smoother and less traumatic for everybody, including the baby.
And I think I saw you pretty frequently when that happened for a couple of days, and it was gone. It was a lot smoother. I think my body was ready. The nurse said, whoa, his head's halfway out. It was about 4 pushes. So it was just a completely different experience this time for me, and the chiropractic care, I think, really contributed to having an easier birth. It helped alleviate a lot of the pain while I was pregnant this time too. Yeah, I recommend chiropractic care for any pregnant woman, just to keep you together, keep your bones. I have already been giving advice to people to get chiropractic care when they're pregnant. I have a sister who's pregnant right now, and I said, go, just get somebody and go regularly, even if you don't have pain, because it really helps to get your body ready and to keep you feeling good. Like I said before, I think it's hard to make time, no matter who you are, but I think definitely being a mom and working full time and trying to keep a family together, it's hard to make time for yourself.